Hi guys, Dr. Epperly here. I just saw a patient, a male above 50 years old, who states that he sees a lipidologist and he's on a low dose of a statin medication. So the first thing I think of is if he's on a statin medication and he's a male over 45 and he's obese and his blood pressure is a little elevated, what is the status of his arteries? So how do we determine what the status of somebody's arteries are? Well, the two main ways we do it is with something called a healthy heart scan or a coronary artery calcium score. And these are obtainable in many places now for about $49. And it's an ultra-fast CAT scan of your heart, which looks for calcified plaque and gives you a score. And the higher your score, the more plaque you have. So that's the first thing. The second thing would be what's called a carotid intimal medial thickness test, which is a high definition ultrasound of your arteries in your neck, which shows you the thickness of the artery wall, because thicker is sicker. And it also shows you how much plaque you have, how thick the plaque is, and whether it's mostly calcified or if it's soft and vulnerable. So I just wanted to point that out to people, that these are the things we need to look at when people are at high risk. The other question that is brought up is whether statin therapy is really effective in preventing heart attacks, strokes, or death in patients who do not have any evidence of significant artery disease. In other words, is long-term use of statins really helpful? The data does not actually support that. So it's highly questionable whether long-term statins in people who don't really have heart disease are really all that beneficial. So stay tuned for more on this topic. It's one of my favorite topics, and have a great day. Bye-bye.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.